Dear doctors, welcome to 𝗲𝗵𝗵𝗺. I am Dr. 𝗵𝗵𝗺 and I am your faculty and mentor. The topic of discussion for today's class is intussusception. Now, please look at this very important diagram in order to understand about the intussusception. So this is the proximal part of intestine which was coming, and this is the distal part which is going away. So what happens is that the proximal part, which is this, is going to get folded in the distal part like this. Okay, so what you have to understand, that because it is getting folded like this, there is going to be retention. There's going to be what? There's going to be retention of the intestinal content, okay, in the distended bowel above the intussusception, and this is called as intercepted part of the bowel. So the proximal part is going to the distal part. Okay, the proximal part is going to the distal part, and there's going to be what? There's going to be obstruction also, which is going to be there. There is a obstruction also which is going to be there. Okay, and this obstruction is actually seen like a claw. Okay, so can you see there is a claw like feature which is occurring? Okay, there is a claw like feature which is occurring. So this claw like feature is called as what? It is called as intussusception. Okay, so this claw is formed, and this is a sign X-ray feature of intussusception, because I think you are able to see this claw, right? This is the claw which will be there. Okay, clear? Good. So what they have done in this is that they have given a contrast enema. It is going till here, and then it is not able to go any further because of the obstruction. So keeping in this in mind, what is intussusception? It is just a telescoping of the portion of the bowel into the adjacent segment that leads to obstruction. And one more thing that this can cause is called as ischemia. Ischemia means the part which is showing obstruction is not going to get its blood supply from the arteries, and there will be ischemia. The cell death, cell necrosis is going to occur. And especially in this cell death and necrosis, this apex is the part which is involved always. Apex is the part which is involved always. Okay, so coming on to next part, see, the most common cause of intestinal obstruction in children is intussusception only. Most common cause of intestinal obstruction. So I for intestine and I for intestinal obstruction. Okay, I for intestine and I for intestinal obstruction and I for intussusception. Okay, I for intussusception. Most common site, again I for intussusception, I for ileocecal junction. Ileocecal junction. We are talking of pediatric population. Okay, in pediatric population, ileocecal is the most common one. Okay, now a question for you to be written in the comment section. Which is the most common site in adults? Okay, it is the most common site in adults. Now, what is the etiology? See, what happens is there is lymphoid hyperplasia in post-viral and like in cases when viral infections are there, so there will be lymphoid hyperplasia. Now, because the lymphoid organs are so much enlarged, that leads to telescoping. Okay, and in older children there might be some other conditions as well, just like Meckel's diverticulum, like polyp, like lymphoma. So what happens in all these conditions? So for example, this is the Meckel's diverticulum. So this part of intestine can even go and can even enter into this part of the intestine. You're getting it? So this part of the intestine can enter in this part. So this is a older children. So Meckel's diverticulum, polyp. This is something which is happening in older children, whereas in younger children, mostly post-viral Peyer's patches and everything is going to happen. Very important hint is this one: Currant-Jelly Stools. Currant-Jelly Stools. There's going to be bleeding, and the bleeding is just like a currant jelly. So Currant-Jelly Stools are seen in intussusception. I always teach students, please don't forget this C. This is telling you Currant-Jelly sputum. Okay, Currant-Jelly sputum. This is extremely important. Okay, and because there is an intussusception, there is going to be a sausage-shaped mass. Okay, which is usually there in the right abdomen. Okay, right? So there is a sausage-shaped mass which is going to be there. There is a Currant-Jelly sputum which is going to be there. Now this triad, forget it. This is not very important nowadays. Actually, it is not seen in most of the cases, so that's why I leave this triad. But then Currant-Jelly sputum is going to be there, and palpable sausage-shaped mass is going to be there. Now, of course, because of the obstruction, there's going to be pain. So there will be pain episodes that are going to occur, and in order to relieve the obstruction, child is going to draw up the legs. Okay, and there will be vomiting. Initially, this vomiting is non-bilious. Later, it is going to become bilious. Okay, but you have to remember it's a bilious vomiting because it is occurring after the opening of the after the opening of your bile duct in the small intestine. Okay, of course there will be lethargy, there will be altered consciousness. Why there is lethargy and altered consciousness? Because of course there is the intestine is not well, so intestine is not going to have proper absorption, and if there is no proper absorption, the patient will not be able to be very active. Okay, now there is empty right iliac fossa, which is called as sign of dance. So why there is a empty right iliac fossa or sign of dance? See, please understand one thing very clearly, that we have told you that the most common site is the ileocecal valve. Okay, so what happens in the ileocecal valve? See, this is actually the colon. Okay, and this is the ileum which is going to get open inside it. So in most of the cases, the ileum is going to get inside the colon. Okay, the ileum is going to get inside the colon. And if it is getting inside the colon, this right iliac fossa is going to get empty, and because of there is a right iliac fossa emptiness, there is a sign of dance or the empty right iliac fossa that's going to occur. So investigation, whenever you do intussusception, you do ultrasound. Ultrasound is going to give you a cut view. So one loop is there, the other loop is inside it. Okay, so this is giving you a which kind of feature? This is going to give you a target or a bullseye sign. That means there is a concentric ring of bowel. This is also called as pseudo-kidney sign. Okay, why pseudo-kidney sign? Because of course there is a bowel edema which is going to be there, and the mesentery is dragged inside, which is going to resemble just like the kidney. So there is a pseudo-kidney sign as well. X-ray is going to show you a claw sign or a coiled spring sign. I think I have shown you this. Claw sign is this. Okay, claw sign or a coiled spring sign which is going to be there. So please don't forget about the target sign as well as the pseudo-kidney sign as well. Okay, now how will you treat that? So we do what? We do this enema and we try to correct it like this. So there is a reduction with the help of air and enema, but surgeries is also performed if there is the shock which is there, peritonitis which is there, failed reduction with the help of enema, and if gangrene, which actually starts from the apex. If any of these conditions are there, this leads to what? This leads to the surgery. Okay, so this is it about the important topic intussusception, that is the most common cause of obstruction in children. Thank you so much for watching. Have a nice day.